Hello, I'm Professor Olivier Glehen. I'm at the head of the Surgical Oncology Department in Lyon Sud in France. And it's a pleasure for me to be here as an expert in this congress dedicated to peritoneal surface malignancies. This is probably one field in oncology for which we did the most important progresses during the past 20 or 30 years, because we moved from a systematic palliative management to curative management for some selected patients. How? By the development of some surgical techniques and of some intraperitoneal chemotherapy. As peritoneal surface malignancies is a local regional disease, we developed a local regional treatment by combining surgery, cytoreductive surgery, peritonectomy procedures to treat the macroscopic disease, to intraperitoneal chemotherapy combined with heat, which is called HIPEC, hyperthermic intraperitoneal chemotherapy, to treat the microscopic disease and to avoid the recurrence by the means of this microscopic disease. And this combined treatment allows in selected patients to cure some patients that were in the past systematically condemned. The concept is that we had to the treatment of microscopic disease the treatment of the microscopic disease. For many years we did not treat with a curative intent this kind of patients because the patients recurred by the means of the microscopic disease. So the combined treatment are really important in several etiologies to offer to the patients relapse sufficiently long. The impact is pretty high. I can give you some example for colorectal peritoneal surface malignancy. For example, you had 20 years ago with systemic chemotherapy alone a median survival of 6 months, and now with surgery alone you may obtain median survival of more than 40 months. And with more selection, you may obtain median survival in specialized centers of more than 60 months. So it's a huge difference in patients that are strictly selected in experienced centers. So I went there since now 4 years, and I participated to each annual meeting dedicated on peritoneal surface malignancy, and I think that India, as other countries, did a big step in the development of this kind of combined procedures. The things that is the most important for me, because this is specialized surgical procedure, this is specialized management of intraperitoneal chemotherapy, is the establishment of expert centers in peritoneal surface malignancy. It requires not only good surgeon with good surgical skill, but also good medical oncologist, radiologist, pathologist, to establish for every patient the best overall management to offer them the most chance of long-term survival. I'm always happy to be here and to share my experience with the experience of Indian surgeon, and even if I'm an expert in my country, I'm learning a lot for each conference.